What are the global trends in headache and migraine diagnosis? Have you ever wondered how the world is tackling headaches and migraines? The trends in diagnosis are changing rapidly, and it is essential to stay informed. Over the past 30 years, the global prevalence of headache disorders, including migraines, has surged. In 2021, around 2.81 billion people were affected by these conditions. This marks an increase of over 57% since 1990. When we look specifically at migraines, more than 1.16 billion individuals were impacted, showing a 58% rise in prevalence during the same period. This increase is not just a number. It translates into a significant rise in disability-adjusted life years, which measure the overall burden of disease, including years lost due to disability and early death. Interestingly, the burden of migraines is not evenly distributed. It is rising particularly among males aged 10 to 59 years and adolescents. Historically, these groups have received less attention compared to females. In fact, migraines are now the leading neurological cause of disease burden in adolescents and the second most burdensome condition for adults aged 20 to 59. This age range is critical, as it includes key periods for education and career development. However, diagnosing migraines can be tricky, especially in younger children. They often struggle to report their symptoms accurately, leading to high rates of misdiagnosis. Regionally, we see disparities in migraine burden and diagnosis. Areas with a high socio-demographic index report the highest prevalence rates, while middle socio-demographic index regions are experiencing the fastest growth in migraine burden. Countries with advanced healthcare systems, like Singapore, are seeing a rapid increase in migraine prevalence. This may be linked to lifestyle changes and stress factors, despite having better diagnostic capabilities. On the other hand, countries like South Korea and Thailand show lower or decreasing trends in migraine burden, possibly due to improved management or underdiagnosis. From a diagnostic standpoint, the International Classification of Headache Disorders, 3rd edition, provides standardized criteria. However, it highlights the differences in diagnosing migraines in children compared to adults. Older adults present additional challenges due to other health issues that can mask or complicate migraine identification. Looking ahead, predictive models suggest that the global burden of migraines, especially among males aged 10 to 59, will continue to rise. This indicates a growing need for improved diagnostic strategies and management worldwide. To address these trends, we need to focus on several practical applications. First, enhancing awareness and education about migraine symptoms across all age groups is essential. This is particularly important for adolescents and males. Second, improving diagnostic tools and training for healthcare providers can help reduce misdiagnosis, especially in children and older adults. Tailored public health interventions are also necessary to consider regional socioeconomic and healthcare disparities. This will improve access to diagnosis and treatment. Finally, adopting new diagnostic technologies and non-invasive treatment options is vital as our understanding of migraine pathophysiology evolves. In summary, the trends in headache and migraine diagnosis show a rising prevalence and burden, shifting demographic patterns, and significant regional disparities. Addressing these issues will require targeted efforts to improve diagnostic accuracy and healthcare delivery.